This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is Breast Cancer Myths and Screening Options and is sponsored by King Quality Construction. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes, and your questions will remain anonymous as always. Today's presenter is Dr. Amina Farouk. Dr. Farouk is a resident physician and an aspiring breast radiologist. She received her medical degree from the Medical College of Georgia and completed her internship in Atlanta before moving to Long Island for her diagnostic radiology residency at SUNY Stony Brook and Mather Hospital. She is associate manager of the RaidAid International Breast Imaging Program, serves on the newsletter committee for the Society of Breast Imaging, and was nominated by the American College of Radiology to serve as the radiology resident representative for the American Academy of Medical Colleges. She currently serves as the president of the New York State Radiologic Society Resident and Fellows Section. Dr. Farouk, you can go ahead and get us started today.
Excellent. Thank you so much. Welcome, everyone. Today, it's good to be here for this presentation. I have a lot of, material for you guys today, and we're going to, get through it. And hopefully this will be informative, just on, a level for you to have a better understanding of what are some of the myths floating around there about breast cancer, and then also to have a better understanding of your screening options. So I want to start off our first section talking about breast cancer myths. So the format of this is going to be, I'm going to give a slide and ask you if it's a fact or a myth, give you a second to think about it, and then tell you what it is, and then just go into a little bit of an explanation about what some of the facts are that are alternative to the myths that you sometimes hear out there. So we'll start with our first one. The first myth versus fact is breast cancer can be prevented. So I just want you to think about this. You may or may not have heard this statement floating around. I can do this, I can take these supplements, I can, do these activities to reduce my risk. And that is in fact, next slide, please, a myth. So, and the reason is, next slide, is because the actual etiology, and by that word, I mean the cause of cancer at a cellular level, is that your DNA gets damaged, okay? And when your DNA gets damaged, it causes the cells within your breast to mutate. And over time, as the number of mutated cells grow and accumulate, either in greater proportion to your normal breast cells or the same, you develop breast cancer. And the fact of the matter is that there are so many different things out there that can cause damage to your DNA and then result in a mutation that causes this cellular overgrowth. So we can't just pinpoint and say, oh, you take care of this one factor and you'll never have breast cancer, or you take care of these 2 or 3 factors and you'll never have breast cancer. It's actually, there's so many different causes and variables, and that's why it's important that all women, regardless of all the measures that you take to live a healthy life, meaning exercise, eat healthy, reduce stress, you have to be screened to ultimately reduce your risk. So that's the first one. All right, so our next one, this is just going into some facts. So 1 in 8 women in the US will develop breast cancer in her lifetime. You guys may have heard a bunch of different statistics thrown around us with regards to the frequency of breast cancer. And this one is in fact true. So the statistics are that 1 in 8 women, and I know that we have more than 8 women on this webinar right now, will develop breast cancer. And that can be a pretty scary statistic for people to hear. But I also think that it's motivating because when you realize how common it is, then you take action to help yourself, to help the women in your life, the women in your community, um, and for them to take action to screen and do all the things to reduce their risk. Right, next slide. All right, and a couple of more things. So breast cancer is actually the most common cancer in American women after skin cancer, because of the things that breast radiologists and other physicians do in promoting screening for breast cancer. There are over 3.5 million breast cancer survivors today in the US. So again, this is motivating information for you, that just because there is an increased risk and increased frequency of women getting diagnosed, that doesn't correlate necessarily to a negative survival rate. So again, motivation for you to take charge of your health and screening. Next slide, please. All right. So our next myth versus fact is men cannot get breast cancer. So I don't know if any of you in the audience know any men who have been diagnosed with breast cancer. I do from my role as a physician. I don't know anyone in my personal life who has. So that's okay. But this is in fact a myth. Men can get breast cancer. And because it's so rare, you often hear this being thrown around that, oh, only women get breast cancer. But that's just not true. What is true, in fact, and we can go to the next slide, is that actually the next slide, I'm sorry. So is that the anatomy of the breast is slightly different between men and women. Okay, so in this slide, you see here that women's breasts are primarily composed of fat, connective tissue, ligaments, lymph nodes, nerves, and blood vessels. And in women, we have a unit that makes up our breast, and it's the functional unit is lobules. And the anatomical difference between men and women is that women have lobules, men don't have lobules. And so men can't get a specific type of breast cancer known as lobular breast cancer. So this, this is one of the fundamental differences between female and male breast cancer, but it doesn't mean that men don't get breast cancer. And so that's something that I do want you to take away, because we are going to talk about genetics, and that's going to be coming up, and this is relevant to that. So next slide. All right, and there we have it. So another myth versus fact is breast cancer is genetic. So you may have heard this statement amongst your family, friends, acquaintances: I have no family members with breast cancer, therefore I'm not at risk. And this is in fact a myth. Not all breast cancer is necessarily genetic, but breast cancer can also be genetic. And so I know that this is a little confusing. And so here I've circled myth. And the myth is actually referring to the second statement on the slide, which is I have no family members with breast cancer, therefore I'm not at risk. This is a false statement, okay? However, breast cancer is genetic can be a true statement, because there are certain genes that if you are tested positive for them, have an increased risk of breast cancer. So we'll talk about them in our next slide. So the high risk breast cancer genes, that are out there are the BRCA1, BRCA2, and PALB2. As of now, there's constant research being done on different receptors. So, this can change, but what we've known for several years now is that these are the 3 most high risk genes for getting breast cancer. And what could increase your suspicion that you might carry this gene? So, breast cancer diagnosed before the age of 50, male breast cancer at any age. So, as we talked about earlier, male breast cancer is very, very uncommon. However, if you do know someone with it, someone in your family, then you should think about getting genetic screening just to make sure you don't have one of these high risk genes. And again, if you do have one of them, you could have multiple relatives on the same side of the family with breast cancer, multiple breast cancers in the same woman, both breast and ovarian cancer in the same woman. And oftentimes people with an Ashkenazi Jewish heritage have higher risk of having some of these high risk genes. So these are just some things to think about. So what do you do if you are testing positive for one of these high risk genes? The most important thing to do is to start with an early detection plan, okay? This can involve starting screening at a younger age, getting screening with ultrasound and MRI, getting preventative surgery, and then of course genetic counseling to see if the rest of your family members need to be tested as well. So these are all things that are highly recommended if you end up being tested positive for one of these genes. Next slide. All right, our next myth versus fact is breast cancer is painful. And this I want you guys to think about for a second, because a lot of women think, if they're walking around, they're not feeling anything with their breasts, no lump, no issues, no tightness, no discharge, there's nothing wrong. So next slide. Breast cancer being painful is in fact a myth. Next slide. The most common presentation of breast cancer is actually completely asymptomatic. So you could be walking around completely normal, not feeling anything, and there could still be cancer growing inside your breast. Now, there are other symptoms that could present as well: nipple discharge, skin thickening, a change in the size of your breast, a palpable mass, and sometimes you could get breast pain. But again, it is definitely not the most common presentation that we see of breast cancer. And this is increasingly important. That's okay, next slide. Because if you don't know that how breast cancer presents, right? If it could present completely normally, then you have to do something about it to catch it early. And this brings us into breast cancer screening. And this is the whole reason why breast cancer screening is so, so, so important, because really the chances of you feeling it and diagnosing it at a point where it's early and treatable is so rare that we recommend this screening process. So what are your screening options and what do they entail? So the most common thing that we use as doctors to diagnose and screen for breast cancer is what's called a mammogram, okay? Some of you may have had this in the audience, you may have known people who have had it, or you may be about to be getting your mammogram done. And so what this is it's a three-dimensional x-ray of your breast. And you may hear the term thrown around, a diagnostic versus a screening mammogram. And essentially, it's the same process. You go into an x-ray machine and they compress your breast, take an x-ray. A diagnostic mammogram is when you actually tell your doctor, hey, I feel something, there's an issue, there's been some change in my breast, and I want to get it evaluated. So in addition to taking standard views of x-rays of your breast, they'll also take some more specific images of the area that seems to be a problem. And so that's the difference between diagnostic and screening. We also have 3D mammograms, and that's what's called tomosynthesis. And this allows us to basically three-dimensionally look at that X-ray that we just took of the breast. And it's highly recommended that you go to a breast center where they do tomosynthesis in addition to your regular breast mammogram, because it has almost a 30% more accuracy in detecting breast cancer than a regular mammogram alone. So that's why it's recommended. It doesn't take too much more time than a regular mammogram. And so that's why it's recommended to do that on your screening visits as well. Next slide. All right, so what do you do in the event of an abnormal mammogram, or if you're someone that's relatively young, you're still hormonally active, and so you have very dense breasts? If you have either of those two situations, the next step that your doctor will recommend is to get an ultrasound. Okay, and what an ultrasound is, it's the same technology that if you've been pregnant before and they use to check the baby. They're using sound waves to look at abnormal tissue and basically assess it, see what its characteristics are, where it's located, and what it's doing to the surrounding tissue. And so if you have an abnormality, or if your breasts are really dense, your doctors will recommend an ultrasound. They'll use some gel, they'll scan the area, they'll also scan the surrounding breast just to make sure that they don't pick up anything else that wasn't seen on your normal mammogram. The ultrasound tends to be a little bit more sensitive, so oftentimes people will get that done as well with their regular mammogram. All right, next slide. Breast MRI. All right, so chances are that unless your mammogram and ultrasound results are inconclusive, you likely won't need a breast MRI. This is typically done for either high-risk patients or done in patients who are about to start their treatment to look at what the results of the treatment were. If they're able to see the breast cancer on your mammogram and through ultrasound, and they're able to biopsy it using either of those two, then they won't do an MRI. But in the event that you do qualify for an MRI, you're placed in a scanner. This is the MRI machine. And oftentimes, and a lot of patients don't know this, but you'll be placed in what we have known as MRI breast coils. So you'll actually be lying down on your belly, and they'll take the MRI of your breast that way. So this is often something that patients are unfamiliar with, but that is how it's performed. You'll move in and out of this MRI scanner while they perform the test. And this does not use any radiation. So it's all magnetic fields that are being used for looking at your breast. And so that's a benefit for that. And that's why oftentimes we'll use it in younger patients who are high risk. So that's the situation with breast MRI. Next slide. And that is the conclusion of what I have for you guys today. I'd like to point out some additional resources for you guys to check out if you have any more questions. The National Breast Cancer Foundation, the National Cancer Institute, and the American Cancer Society are the most reliable resources to answer any questions or concerns that you guys have as you or your family members undergo treatment. So I would refer you there. And I'd just like to thank you all for for being here, for listening. You know, I've had very close family members who have breast cancer and who I've witnessed the treatment for and this whole process. And so I understand that it can be very overwhelming for the patients, for the family, and rest assured that your doctors and your treatment team, they're looking out for you. And you should always feel free to ask them questions and reach out to them anytime because that's what they're there for. So with that said, I'm happy to take any questions about the presentation or even anything else if you guys have them.
That'd be great. Thank you so much, Dr. Farouk, for taking the time to present with us today. Some really great information here. If you guys have any questions, please feel free to enter them in the Q&A. We'll give it about a minute. In the meantime, after the webinar, you'll be receiving a survey just that talks about how the webinar went today, your experience, and any other topics you might be interested in. We'd really appreciate it if you could fill that out for us. It helps us improve our future webinars. All right, give it another couple of seconds. All right, great. Dr. Farouk, we won't keep you any longer. Thank you so much for your time today. And everybody enjoy the rest of your day.
All right. Thank you so much. Take care, everyone. Bye.